You should never feel helpless. There's definitely many things that you can do in order to control the disease or control your transitioning into having diabetes if you do have that predisposition to it.
There are lots of possible causes of type 2 diabetes. Insulin resistance is at the heart of the problem, so where insulin in the body doesn't work very well. That could be genetic, that could be related to overweight or obesity, and it could also be related to inflammation. Inflammation has been linked with fat changes in the body, which then make insulin work very poorly.
Other risk factors include being a certain age. With time, just being older, it predisposes you to have diabetes. Another important thing is family history. If you have a first-degree relative, meaning a sibling or a family member like your parents who have diabetes, your chances really increase a lot more for you to have diabetes.
Ethnic background is important, so Asians and Southeast Asians tend to get diabetes very readily. People of Hispanic origin also are at very high risk. People with African American heritage also are at very high risk.
So there are certain things that we have control of when we talk about diabetes and things that we don't have control of. You don't have control of your genetic predisposition. So in that regard, you can't prevent or do anything about genetics. But the things that you can focus on are diet, exercise, and just making very wise and healthy lifestyle choices.
Patients who have risk factors for diabetes should be tested earlier and more frequently to make sure that they haven't developed type 2 diabetes. Type 2 diabetes is very common, and up to 1/3 of patients don't realize they have diabetes because symptoms of mildly elevated blood sugar are not significant. So this is why it's important to go to your doctor on a regular basis and be screened at appropriate intervals to make sure you don't have diabetes.